Hi, this is Brian Kim. I want to share with you case number 256 in the Best Way to Do Cataract Surgery series. And the title of this series is not to suggest this is the best way, but to get you to think critically of your technique, thinking about ways to refine and hone your technique so that you can provide the very best for your patient. So this is a moderately dense cataract, small pupil. You're going to see my technique of double chop and cross chop to rapidly disassemble this lens through a small pupil. And then I will place the Hydrus Microstent. So this is the patient's eye. You can see the pupil is kind of on a small side, about a medium-sized pupil. I'm going to use a corneal marker, which will help me to center and size the rhexis. I use a cotton tip to stabilize the eye as I do this. And then I make my paracentesis incision, first on the right side and then the left side, making sure I'm parallel to iris plane. But you see here, I'm going to make my incision for the Hydrus Microstent as well. And my tip on when you're doing the microstent is to make your incision early, because if you have bleeding and you have bleeding on the corneal surface, it can cause interface bleeding mixed with the viscoelastic and obscure your view. Make all three incisions, and then I'm injecting some intracameral epinephrine and then some dispersive viscoelastic to coat the corneal endothelium and to flatten the anterior capsule. I always keep the cannula in there to control the eye. And this is the triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel, and then I enter. I keep that cannula in there, again, to control the eye. And these are the microrhexis forceps. I go in sideways, puncture the center, pull down towards me, grabbing the right side of the tear, going around circumferentially. I have very good control of the rhexis, minimal OVD egress, minimal radialization forces. With this microforcep, I just grab and re-grab, trying to make the rhexis the size and centration of the corneal mark that I made. Placing some viscoelastic on the surface of the cornea. In this way, the technician doesn't have to keep putting water on the surface of the eye. And this is the capsule fornix hydrodissection technique. I place a cannula under the rhexis edge contra-incisionally, get a wave, lift the lens up, decompress the bag now. Sweeping underneath the lens on the left side, and then on the right side, and the lens begins to spin. Lifting the incision with the chopper, going in with irrigation off to minimize Descemet's trauma. Pronating my hand slightly, so I'm leading with the chopper tip. You see it's pointed down a little bit, and I do that on purpose so I can slide it under the rhexis edge. I hook the peripheral lens with the chopper now because I am placing that chopper at the equatorial level on the peripheral level of the lens. I turn the phaco tip vertically subincisionally, and now I have the lens, the endonucleus, flanked by the chopper distally and the phaco tip proximally. Now that the lens is flanked, I bring the instruments together and I fracture the lens completely in half. I pronate my hand once again, flatten out the chopper, sliding it under the rhexis edge, under the right heminucleus, sliding it so that it clears the anterior capsule, turning it vertical, hooking the peripheral lens equator, placing the phaco tip deep in the trough, pulling the chopper against the phaco tip, and it fractures the lens completely in half. Lifting that first quadrant up, hooking that first quadrant with the chopper, and then crushing it again with the cross-chop maneuver, and then utilizing mechanical fracturing forces, and then emulsifying the lens piece. Turning the second quadrant around, placing the chopper around the lens, pulling it centered toward the phaco tip, again crushing the lens with another cross-chop maneuver, and then emulsifying the lens pieces. Hooking the peripheral lens with that piece again, getting it up, and then fracturing it. Turning the second heminucleus in front of me, placing the chopper around the lens equator, placing the phaco tip deep, pulling the chopper towards the phaco tip and crushing the lens in half, using some vacuum to grab that third quadrant, hooking the peripheral lens and crushing it again with another cross-chop maneuver with mechanical fracturing forces. Using some vacuum to lift that fourth quadrant up out of the bag, loosening it up, placing the chopper around the lens, hooking the peripheral lens, using some vacuum to lift it a little bit and then crushing it in half, using some vacuum to grab that fragment and then crushing it between the instruments and then emulsifying the lens pieces. Grabbing that last fragment with some vacuum, again crushing it between the instruments and then emulsifying the lens pieces. This is some rather thickened epinucleus. Go ahead and lift it with some vacuum and then crushing it with the instruments and then emulsifying the epinucleus. So far, rather easy disassembly of this lens in this medium-sized pupil. Somewhat of a dense lens, but nothing that the techniques could not overcome. Again, using some vacuum to grab the epinuclear pieces, but as you can see, they're rather stiff. But I'm just using high vacuum to remove those pieces. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INE handpiece. Starting subincisionally, I'm starting to remove the cortex from anterior to posterior. By peeling it from anterior to posterior, you get the cleanest removal of the cortex. Switching to polish mode, polishing the posterior capsule, polishing under the rhexis edge as well, polishing subincisionally. And then once I grab that chunk, I switch to cortex mode, eat up the piece, and then switch back to polish mode. That's the nice thing about polish mode. You can go fairly deep within the capsule or fornix, and you don't worry about grabbing the capsule and ripping any zonules because it's so gentle. Pulsing BSS into the subincisional capsule fornix, which was clean, turning off infusion, and then pushing cohesive viscoelastic to fill the bag. Again, you can see that the pupil is somewhat small, so I don't see the rhexis edge here. Doing a little bit of polishing, I made sure that as I pushed the cohesive viscoelastic, that the iris is a little bit more anterior to the capsule, so I don't sweep on the iris too much. And this is the Bausch & Lomb LI61AO lens, pushing some more viscoelastic in, allowing the injector to go in all the way, making sure that the leading haptic goes into the bag. You want to keep pushing, and as you push, the optic goes in. Push a little bit more, retract, and then reposit the trailing haptic into the bag. Pushing some viscoelastic to open up the angle, and then placing some viscoelastic on the cornea. Placing the Hydrus through that incision, and then the gonio lens, the gonio prism. You can see the blood. You want to stab into the anterior trabecular meshwork, angle it slightly upward. You want to stab, and this is kind of the hard part. You want to make sure you stab without it slipping. So you stab into anterior TM, point it slightly upward. And once you feel like you got there, go ahead and advance the device. You can see it's advancing pretty nicely. You want to withdraw directly back, and then go ahead and push with the tip of the Hydrus. There's a notch at the tip of the Hydrus there, so you can use the injector as a shovel, kind of push that notch in so it advances the Hydrus a little bit more. You can see the blood coming out, which confirms that you are in the right place. Pushing some cohesive viscoelastic to improve my view. You can see a well-positioned Hydrus. So go ahead with the IA, go in with irrigation off, activate irrigation, removing all the viscoelastic from within the bag. And then I'll remove the viscoelastic from the anterior chamber. Polishing under the rhexis edge a little bit here. Moving all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a patient with somewhat of a dense lens, small to medium-sized pupil. You saw executed the double chop and cross chop technique, efficiently disassembling the lens, again leading with the chopper, holding it a little bit sideways, pronating my hand, pushing down on the lens, sliding it under the rexus edge each time. But once you get out, you want to turn vertical with the chopper so that the tip is down and around the lens equator. As the chopper is out at the lens equator, you can turn the phaco tip vertically, stab the subincisional lens material. You're essentially flanking the lens, and I'm able to divide the lens very quickly with the double chop maneuver, placing the chopper around the right heminucleus in similar fashion, sliding the chopper, turning it sideways, sliding it under the rexus edge, and then turning it vertical, making sure that the chopper is hooked around the peripheral lens, pulling it centrally toward the phaco tip, which is positioned deep between the lens pieces, and then you're able to pull the chopper towards the phaco tip, and it crushes the lens as if the phaco tip is a chopping block. And you saw that there was very little CDE, and I maximized mechanical fracturing forces to crush the lens into smaller pieces. This enables clear corneas post-op day 1. And then at the end, you saw very efficient placement of the Hydrus Microstent. And at the end, you saw some blanching of the vessels, which confirms proper placement. So I hope this was helpful to you, and I thank you for your attention.